Welcome to the third BMAS Podcast. In this episode, we meet Caroline Rubens, a GP from Tunbridge Wells, half an hour down the road from me. Caroline has a particular interest in the use of acupuncture in palliative care for patients who are suffering from the after effects of cancer treatment, and she has an interesting history. Later, we travel over 1,000 miles to Porto, in the north of Portugal, for a chat with Helena Pinto Ferreira, the president of the Portuguese Acupuncture Society, who is heavily involved in European acupuncture diplomacy. Trying to get a consensus within 12 countries strikes me as a Sisyphean task. Sisyphus was a chap in Greek mythology who had to roll a rock up to the top of a hill every day, only to find in the morning it had rolled down, and he had to start all over again. However, Helen is quite upbeat and optimistic about her task. And then finally, we jet back to London to hear from Alison in the BMAS office. What's been and what's to come.
So I'm here today with Caroline Rubens. Caroline's a GP and also an acupuncturist, and she's agreed to have a chat with me so that we can find out a few of the things that she does. So, Caroline, first of all, where is it you work?
I work mostly in Tunbridge Wells as a GP. I also have an acupuncture practice there and work in the local hospice there. And then I work up at the Royal Marsden in Sutton.
And what type of patient comes to you?
I get a variety of patients, really. Within general practice, I largely tend to treat patients who have musculoskeletal pain and headaches with acupuncture, but I might opportunistically treat other conditions. At my purely acupuncture clinic, I can see a wider range of conditions. Really, people tend to present with all sorts of problems, and I will assess at the time whether I think acupuncture is appropriate or not. Up at the Royal Marsden, we treat cancer patients for the side effects of their treatment. For example, chemotherapy-induced hot flashes, post-surgical pain, or joint pains from aromatase inhibitors. But we also treat other symptoms such as xerostomia, or dry mouth, for head and neck cancer patients, and also urinary problems, gut motility problems, and many more.
That sounds quite a specialised area to work in. Are you one of few who do that, or a group?
Well, there's predominantly two of us. The clinic was set up by Jackie Filshy about 30 years ago, and I got involved about 8 years ago, and have been working there ever since. It's really a pain clinic, but it's become very much a specialised acupuncture clinic for these patients, and it's also a great form of psychological support for them when they're going through their treatment.
What was it that got you interested in acupuncture in the first place?
Well, I observed a GP colleague doing acupuncture at my training practice in inner city London, and I was very impressed with his results and also the interaction that the GP seemed to have with his patients when performing acupuncture. And this seemed to be particularly important in this population with a mixed ethnic background, often with people who didn't speak much English, and I found that the acupuncture really helped to increase communication with the patients and also diminish any cultural differences. And I thought this might be a practical skill I'd like to learn.
So you did some training?
So I did some training, and I've absolutely loved doing it ever since, really. I find being able to do something straight away for a patient that is hands-on and can often have quite quick results. It's very rewarding, both as a practitioner and it's very beneficial for the patient.
And do you find that you prescribe less painkillers now than previously?
Oh, well, definitely. I would possibly put myself on the prescribing side of the spectrum anyway, but I feel that I will often suggest acupuncture or other physical therapies rather than medication, particularly in people who might experience side effects from these.
Some bad news for the drug companies.
Possibly.
Shame. Now, do you have any advice for any colleagues or anyone, in fact, who's interested in studying acupuncture? Would you suggest that they go into a course? Would they go and observe somebody like yourself? What would be the best way to do it?
I think if you're sure that you want to do it, then certainly to go on a foundation course is a great idea. If you're not sure, then it might be an idea to get in touch with a local acupuncturist, or perhaps call the BMAS and see if there's somebody they could put you in touch with, and just go and see what they do and see if it's for you. I often have people shadowing me in the pain clinic at the Marsden, and then come on to do the foundation courses.
Mm-hmm. Did you have any problems when you started?
I didn't really. The only problem I had was that I quickly found I had a large group of patients wishing to see me in my general practice repeatedly just for acupuncture, and I had to develop systems to manage this so my surgeries weren't completely overrun with acupuncture patients.
Victim of your own success.
Not very good at managing workload, possibly. But in terms of people wanting to start acupuncture and training, I think that it's very good to obviously do your initial foundation course, but once finishing training, I think it's important to sort of keep going and whilst you're enthusiastic, because it can be difficult to continue that enthusiasm back in your practice if you're not surrounded by other acupuncturists, or perhaps if your colleagues are sceptical. So I think it's really important to build in confidence early on. So I find people say they've not needed much after the course as they've lacked confidence. I think the BMAS is a very good source for putting you in touch with local groups and for mentoring and support, which can be invaluable.
I know that you're quite a regular attendee at the local regional group.
I try to get there.
You find that helpful?
I certainly think it's very helpful to meet people locally and just to be able to discuss in an informal setting any acupuncture issues or queries you might have just in a supportive group when perhaps you might not be surrounded by acupuncture in your daily work.
Good. Okay, well, thank you very much, Carolyn.
Pleasure.
So today I'm in Portugal, in the town of Porto, and it's the British Medical Acupuncture Society's autumn conference, scientific meeting, and with me is Helena Pinto Ferreira, who is the president of the Portuguese Acupuncture Society and also the president of the International Council of Medical Acupuncture and Related Techniques, known affectionately as ICMAT. So, Helena, can you tell me a little bit about your activities with ICMAT and perhaps with the Portuguese Acupuncture Society?
Well, the main activities in Portuguese Medical Society is to spread the information about how acupuncture works and the indications for acupuncture and the contribution that it can bring to the medical activity, and especially for the patients. I think we are being successful because acupuncture was recognized by our medical association 10 years ago, and now we have medical doctors using acupuncture inside the public health system, which means especially also inside hospitals, in pain units, and also in what we call the health centers for ambulatory care. Of course, also in the private sector, but nevertheless, I think it is growing, and the interest among the other specialists is also growing.
Is the economic benefit one of the main driving forces here?
Yes, also, and also the problem of the side effects, because we have a lot of chronic diseases. Pain, of course, is one of the main reasons, and they are starting to be aware that acupuncture can give really benefits to these patients.
You mentioned yesterday that there's a project called Cambrella, trying to unite 12 different countries.
Yes, Cambrella was developed under the 7th framework program of the European Commission. So they have funding to search several parameters, which is the aim of the project was to especially the understanding of the status of the several camp therapies around Europe, and also to build a roadmap for the research on these therapies.
How do the different countries differ in their approach?
Yes, they differ a lot because when they try to realize for example, what camp therapies were really in each country, they were different already. At the start, they were different. And then the terminology was also different. And the way that people were facing these kind of therapies were different. So each country have different ideas, different camp therapies, different position on the regulatory point of view also. And this brought a lot of problems because if we are going to a kind of harmonization between the European Union countries so that people can have access to these therapies whenever country they are, it is really different because...
So could an acupuncturist cross borders without any problem? Could I come and work in Portugal, for example?
I don't think it is so easy because one of the resolutions of the European Commission was that this approach and the legislation related with each of these therapies, it is of national responsibility. So it means that if an acupuncturist from other country that can be accepted there. If it comes to Portugal, it has to be accepted under the rules of Portugal. And the opposite, it is also true. So it is not really so easy.
Maybe we shouldn't hold our breath while we wait.
Yeah. Yes.
Okay. Tell me about the acupuncture scene in Portugal. Is it very well accepted? Do patients like it?
Yes, there is. The patients look for it. Yes, not only on the medical field, but especially on the non-medical field. We have many unregulated professionals. Now there is a law that regulates several professions, but not the professionals yet, because they have to be. The CV or the curricula of the courses are not yet developed, accepted, and so on. So there is a long way until they are regulated.
In the UK, we have two distinct schools of acupuncture. We have the traditional Chinese approach, and we have the Western medical approach. And the two seem to be running in parallel. Is it the same here? Is it the same in Portugal?
A little bit. That means that we have on the medical field, we have 4 universities with postgraduate courses on acupuncture. And we have one with a more traditional approach, but with a little bit of Western approach also. And we have some others with a more Western approach than traditional. So we have...
So the two groups,
they
rub along.
Yes, but we have, it is like in India, we have a little bit of each on all of it.
Yes.
So...
Good. Now, I'd like to ask you about your own history. How did you first come across acupuncture?
Well, I began to study acupuncture on 78, and it was on the time where the Eastern philosophies came to the Western world and start to be, I touched these kind of philosophies and I was interested by them. And
were you a clinician at the time?
I was finishing my studies in medicine.
Right.
Yeah.
Okay.
And so after that, I start learning in several places, like everybody, and developing my own practice.
Right, and you could integrate that easily within your practice.
Yes.
Right. And we talked about the past. How about the future? What do you see happening in the future? Can we replace drugs completely?
No, of course not. I think acupuncture is a complementary approach, and it should be integrated in the several practices in the medical care. And I think it is the best way to use it. Integrated, not alternative.
Not alternative.
Yeah.
Complementary.
Complementary.
Yeah.
Yeah.
Good. Right. Well, I think we've pretty much covered everything that we talked about yesterday. So, thank you very much.
Okay. Thank you. Okay.
Well, now that we're all back from Portugal, have you got anything interesting in the pipeline?
Well, we've got some very exciting things coming up. First of all, if you didn't miss Portugal, you can catch up with Thomas Lundeberg and Armando Almeida, because we've persuaded them to come to London on the 11th of December for a special physiology day. They'll be talking about pretty much the same topics as they talked about in Portugal, but there'll be lots more of it. It's at the very fancy Grand Connaught Rooms in central London, Covent Garden, but places are limited, so if you do want to come, book quickly.
And when is that?
That's the 11th of December. It's the BMAS Christmas bonus.
Very good. And the new year?
In the new year, we've got various things coming up. I want to tell you about our scientific meetings. The spring meeting is going to be in Cardiff this year on the 10th and 11th of May at the Hilton Hotel. So don't miss that. We're still working on the programme. On the 9th of May, just before that, our new palliative day, which is run by Graham Lang and Juliet Spiller, that's going to be held in Cardiff too at a hospice there. So if that's your field, you could add that onto your attendance at the spring meeting. The autumn meeting is going to be in London on the 25th of October. Might be a bit more accessible for some people.
Yeah.
And one more thing for the new year that people might be interested in is Lisa Stenner-Victorian's Women's Health Day. She's coming over from Sweden on the 5th of February, and always a popular course. So if you're interested in that, book soon. Okay, very good. Well, thank you for the update, and presumably people can get more details from the website. Absolutely, or they can phone the Northwich office to book or for more details, or both. Okay, that's great. Okay. Thanks very much.
The British Medical Acupuncture Society, known affectionately as BMAS, was formed in 1980 as an association of medical practitioners interested in acupuncture. It is now a nationwide group of over 2,700 registered doctors and allied health professionals who practice acupuncture alongside more conventional techniques. BMAS believes that acupuncture has an important role to play in healthcare today and promotes the use of acupuncture as a therapy following orthodox medical diagnosis by suitably trained practitioners. BMAS runs training programs in the UK for doctors, dentists, osteopaths and other healthcare professionals. Go to our website www.medical-acupuncture.co.uk for more information. Thank you for listening to this podcast. It was produced and directed by Bill Ferguson, registered osteopath and member of British Medical Acupuncture Society.